name is Dr. Ibrahim Abd Elrahman. I'm a consultant gynecologist here at King's College Hospital. We're going to be discussing abnormal and normal pap smears and colposcopy. Pap smear is a simple gynecological test that's done to assess any abnormalities on the surface of the cervix. The cervix is basically the neck of the womb. It has a part that's in the pelvis and a part that's in the vagina. When you have the pap smear done, we put a speculum in, look at the surface of the cervix in the vagina, and we use a small brush to collect any loose cells from there. These are then examined under a microscope to assess if there is any abnormality and the degree of abnormality that's there. Ideally, any woman who has become sexually active from the age of 24 should have regular pap smears, usually until the age of 65. As long as they are normal, they have regular assessments every 1 to 3 years. In the NHS is generally done every 3 years. If there are any abnormalities on the smear, then screening becomes a little more frequent and assessment becomes a little more frequent. Smears are done to assess for an abnormality. They're a screening test. They're not diagnostic of anything. They just tell us, look, heads up, you need to take a better look at the cervix to assess if there is a significant abnormality. Now, that's done either by checking HPV status for a patient to see if they have an HPV infection, as well as possibly doing a colposcopy, which is a more thorough examination of the cervix to assess if there are any abnormal areas. Pap smear looks at loose cells on the cervix and tells us we need to look more thoroughly at the cervix. A colposcopy is the next step. Now, if your pap smear is graded, it's graded from normal all the way through to a high-grade abnormality. All of these are screening and suspected abnormalities. For simplification, we say you have a normal pap smear, or you have a low-grade abnormality on the pap smear, or you have a high-grade abnormality on the pap smear. Now, if your pap smear comes up as low-grade or high-grade, you need to have a colposcopy to assess the cervix more thoroughly. If your pap smear comes up as normal, but for some reason HPV testing was done at the same time, and you have a high-risk HPV, which is different from high-grade abnormality, then you need to have a colposcopy to assess the cervix more thoroughly. In all cases, when you go ahead and do the colposcopy, it's done again in the outpatient clinic. It takes about 5 minutes. It's not that invasive a procedure, and this is diagnostic if there is an abnormality on the cervix. If you are referred to do a colposcopy because you either have a low-grade or high-grade abnormality, or you have high-risk HPV, or a combination of both. Now, HPV in and of itself is very widespread in the community. Most young people, when they have HPV, will probably clear it. There's no medication I can give that will make HPV disappear. When you do the colposcopy, it's a very straightforward procedure. You have a speculum examination like you have when you have a smear. And when we do that, we're looking at, through the vagina, at the cervix here. When we see the cervix, you put some fluid on it to see if any abnormalities appear. We start off with acetic acid, and that will make the abnormal areas appear more white. Having done that, you put on some iodine. Iodine makes the abnormal areas appear paler. If these abnormal areas appear, now they can be graded as just what's called metaplasia, which is changing from one type of cell to another, but not cancerous. Or they can suggest abnormalities. We can take a very small biopsy, about 2 millimeters or 3 millimeters in the clinic. Feels just like a little pinch. We take that, and that gets sent off to the laboratory to be assessed under the microscope. Whereas a smear, when we do it, will have a few dozen cells to assess. A biopsy will have hundreds of cells, so we'll be able to get a much more accurate diagnosis. There is one final point to mention about assessment and treatment for pap smears. Treatment should be done in a stepwise fashion. It's not just my recommendation, it's recommendations from the national societies in the US, in the UK, and in Europe. Patients should be managed in a stepwise fashion. The first thing is to have your regular pap smear. If you haven't had a pap smear and you're examined and the doctor feels there is an abnormality on the cervix, it's a very valid thing to have a pap smear carried out. The old policy of see and treat, which was 20, 30 years ago, is really not applicable now. Things should be managed in a stepwise fashion, because moving from normal through HPV, abnormal smear to cancer takes about 5 to 15 years. So waiting a week or a few days for a smear result is not the end of the world, and it's better to just do it in a stepwise fashion to prevent yourself being overtreated. Treatment of HPV depends on the immunity in the body. So your immune system is what will clear HPV. Now, there are between 70 or 100 types of HPVs. Of those, some are high risk and some are low risk. That's different from high grade and low grade abnormality. The high risk HPVs tend to cause abnormal smears. The low risk ones tend to cause genital warts. But they can cross over, so low risk can cause abnormal smears as well. Having a high risk HPV or an abnormal smear means you need to do a colposcopy.